Welcome to today's video lecture on diverticulitis. Before we start, don't forget to check out our website madeformedical.com for hundreds of more videos like this at the end of this video. The link is in the description. In this session, we will explore its etiology, pathophysiology, clinical presentation, diagnostic approaches, and management strategies. By the end of this lecture, you will have a comprehensive understanding of diverticulitis and its impact on patient care. So, let's begin. Diverticulitis refers to the inflammation or infection of small pouches called diverticula that develop in the lining of the colon, most commonly in the sigmoid colon, as mentioned in this picture. These pouches form when weak areas of the colon wall bulge outward, creating small sacs or pockets. Diverticulitis typically occurs as a result of fecal matter becoming trapped within the diverticula, leading to inflammation and, in some cases, infection. The exact cause of diverticula formation is not fully understood, but it is believed to be primarily associated with a diet low in fiber. A low-fiber diet can contribute to constipation and increased pressure within the colon, making it harder for stool to pass through the intestines. This, in turn, can lead to the development of diverticula. When diverticula become inflamed or infected, they can cause a range of symptoms. Diverticulosis is a common condition characterized by the formation of small pouches called diverticula in the wall of the colon, particularly the sigmoid colon. The exact cause of diverticula formation is not fully understood, but it is believed to be related to increased pressure within the colon, leading to weakened areas in the colon wall. Once diverticula are formed, they can become susceptible to microperforation or microtrauma. Increased pressure within the colon, particularly during episodes of increased muscular contractions, such as during bowel movements, can lead to the development of small defects or tears in the diverticula. Microperforations in the diverticula can result in the leakage of fecal material into the surrounding tissues. This fecal contamination can lead to local inflammation and alterations in the gut microbiota composition. Bacterial overgrowth or changes in the bacterial species may occur, contributing to the development of diverticulitis. Inflammatory response. Fecal contamination and bacterial overgrowth within the diverticula trigger an inflammatory response. The body's immune system recognizes the presence of bacteria and mounts an immune response, leading to the release of pro-inflammatory cytokines and chemokines. Inflammation and infection can progress, resulting in the formation of an abscess. The abscess is a localized collection of pus and inflammatory cells that develops in the vicinity of the affected diverticulum. It can cause further damage to the surrounding tissues and structures. In severe cases, the inflammation and infection associated with diverticulitis can lead to bowel obstruction. The abscess or inflammatory response can cause swelling and narrowing of the lumen, impairing the normal passage of stool and leading to symptoms such as abdominal pain, bloating, and changes in bowel habits. Perforation and peritonitis. In some cases, the inflammation and infection can progress to full-thickness perforation of the affected diverticulum. This can lead to the release of fecal material and bacteria into the abdominal cavity, resulting in peritonitis and inflammation of the lining of the abdomen. Peritonitis is a serious and potentially life-threatening complication of diverticulitis. Scarring and complications. With recurrent episodes of diverticulitis, the inflammatory process and healing can result in the formation of scar tissue. This scarring can cause narrowing or strictures within the colon, leading to complications such as bowel obstruction or fistula formation. The clinical presentation of diverticulitis can vary depending on the severity of the condition. Abdominal pain is the hallmark symptom of diverticulitis. It is usually localized to the left lower quadrant of the abdomen, corresponding to the location of the sigmoid colon where diverticula are commonly found. The pain is often described as crampy or constant and may worsen with movement or palpation. In some cases, the pain can be more diffuse or involve the entire abdomen. Inflammatory processes associated with diverticulitis can trigger a systemic response, leading to fever and chills. Elevated body temperature is commonly observed and may be accompanied by sweating and chills. Diverticulitis can cause alterations in bowel habits. Patients may experience changes in their normal pattern of bowel movements, such as increased frequency, urgency, or constipation. Diarrhea may also be present in some cases. Gastrointestinal symptoms like nausea and vomiting can occur in diverticulitis. These symptoms may result from the inflammatory response, bowel obstruction, or irritation of the gastrointestinal tract. On physical examination, Patients with diverticulitis often exhibit tenderness to palpation in the left lower quadrant of the abdomen. The area may be particularly sensitive when pressure is released suddenly, rebound tenderness. Abdominal distension and guarding may also be present. While rectal bleeding is more commonly associated with uncomplicated diverticulosis, it can also occur in diverticulitis. Bleeding may manifest as fresh blood in the stool or as melena, dark, tarry stools if there is significant bleeding higher up in the gastrointestinal tract. The diagnosis of diverticulitis involves a combination of clinical assessment, physical examination, and appropriate diagnostic investigations. Here are the key steps to diagnose diverticulitis. Medical history and physical examination. Begin by taking a detailed medical history from the patient. Inquire about the nature, onset, and duration of symptoms, including abdominal pain, changes in bowel habits, fever, and any associated symptoms like nausea or rectal bleeding. Ask about any previous episodes of similar symptoms or known history of diverticulosis. Perform a thorough physical examination, focusing on the abdomen. Palpate the abdomen to identify areas of tenderness, particularly in the left lower quadrant, where diverticulitis commonly occurs. Assess for rebound tenderness, guarding, and signs of abdominal distension. Laboratory tests. Order laboratory tests to aid in the diagnosis and evaluation of diverticulitis. These may include complete blood count. Look for leukocytosis, which is commonly seen in inflammatory conditions, including diverticulitis. C-reactive protein and erythrocyte sedimentation rate. These markers of inflammation can help support the diagnosis and assess the severity of diverticulitis. Imaging plays a crucial role in the diagnosis of diverticulitis. The following imaging modalities are commonly used. This is the imaging modality of choice for diagnosing diverticulitis. It can identify the presence of diverticula, signs of inflammation, such as thickening of the colon wall, and the presence of complications like abscesses or perforations. While less commonly used, ultrasound may be employed if there are contraindications to CT or as an initial screening tool, particularly in younger patients or when assessing for complications such as abscesses or free fluid. Abdominal X-rays may be obtained to evaluate for other potential causes of abdominal pain and to rule out complications such as bowel obstruction or perforation. In complicated or severe cases, or when surgical intervention is necessary, consider involving a gastroenterologist or a general surgeon for further management. The treatment of diverticulitis depends on several factors, including the severity of the condition, the presence of complications, and individual patient characteristics. Here are the general principles for treating diverticulitis. Bowel rest. Advise the patient to rest the bowel by consuming a clear liquid diet for a few days. This helps reduce the workload on the colon and allows the inflammation to subside. Prescribe oral antibiotics such as ciprofloxacin combined with metronidazole or amoxicillin clavulanate to target common bacterial pathogens involved in diverticulitis. The choice of antibiotics may vary depending on local antibiotic resistance patterns and individual patient factors. Recommend over-the-counter or prescription pain medications to alleviate abdominal pain. Schedule a follow-up appointment to monitor the patient's progress and ensure the resolution of symptoms. Moderate to severe diverticulitis. Consider hospitalizing patients with moderate to severe diverticulitis, especially if they have significant pain, high fever, signs of peritonitis, or are unable to tolerate oral intake. Administer intravenous fluids to correct dehydration and provide nutritional support. Intravenous antibiotics, such as ceftriaxone and metronidazole or piperacillin tazobactam, should be initiated to provide broad-spectrum coverage against bacteria commonly associated with diverticulitis. Use intravenous analgesics or patient-controlled analgesia, PCA, to manage pain effectively. If an abscess is present, consider percutaneous image-guided drainage under radiological guidance to facilitate resolution and prevent further complications. Encourage patients to adopt a high-fiber diet rich in fruits, vegetables, whole grains, and legumes. Adequate dietary fiber promotes regular bowel movements and reduces the risk of diverticulitis recurrence. Emphasize the importance of maintaining proper hydration by consuming an adequate amount of fluids daily. Regular exercise. Encourage regular exercise and physical activity promote bowel regularity. In conclusion, understanding the clinical presentation, diagnostic evaluation, and treatment options for diverticulitis is very essential. By diagnosing and managing diverticulitis effectively, we can improve the quality of life for our patients. And that brings us to the end of our today's video. I hope you found the information helpful and informative. If you enjoyed this video, don't forget to give it a thumbs up, and don't forget to sign up for a premium membership on our website, madeformedical.com, for more content like this.